When people are like, hey, what do you do? I'm like, I make moms look hot. Flat tummy, narrow waist, perky boobs, perky bum. Everybody's happy. Like,
Nice.
period, full stop.
Yeah. Everyone talks about Botox, filler, and the face, but some of the biggest evolutions in aesthetics is happening below the neck. When your face looks 35 and your body still feels 45, you notice, and so does everyone else. Today, we're talking about the full picture, from face up to neck down, and what it really takes to create balance. My guest today is Dr. Ryan Neinstein, a board-certified plastic surgeon from Toronto and here in New York, who built one of New York's most talked about practices. You might have seen him in the New York Post for creating the Birkin Body, but behind the headlines is a meticulous surgeon who's redefining what full body confidence looks like. From mommy makeovers to comprehensive contouring, Dr. Neinstein is all about proportion, safety, and delivering results that feel as good as they look.
I think a lot of plastic surgery is just making people look different. And this truly solves a problem.
One thing that people always say that you'll look fake if you get surgery. How do you respond to that?
I think the best surgeons make people look as natural as possible.
Yeah.
And it's paradoxical or sometimes difficult for people to understand that you need major surgery to look less done. And you're gonna hate me for like a month, and then you're gonna love me the rest of your life.
Dr. Neinstein, thank you so much for being here.
Tony, thanks for having me. I'm very excited to be here today. I've loved your podcast and I'm really excited to be on it today.
Thank you. No, I'm super excited to get into it with you. You have great energy, and I want to talk about everything that your practice delivers, your ethos, and like what it means to you to
Perfect.
deliver,
So do I.
like the best plastic surgery. Yeah, let's do it. Before I start, I have to ask you something. When we were learning about you, it's been told to us that you only use a Vino baby on your face.
It's just
And
on
you
Ariel
have great
Lorraine's
skin. Yeah.
podcast. And like she's like, what do you do for your skin? I'm like, I either use what my wife leaves out and just like randomly throw stuff together, but I predominantly just use what my kids use, which is a Vino Kids.
That's amazing. I mean,
That and a spray tan. And that's it. That's
your
it.
skin looks great. So this is not a plug for Aveeno, and we are not sponsored by them, but we'll be
But
giving.
I'm happy to be sponsored by Vino
Yeah.
Kids. Like, I will be your spokesperson. I'm down. I've bought a lot of it.
Nice. We'll be gifting you the Dr. Rossi line, so give it a
Okay,
try.
Good. I'm ready
Yeah.
for the elevated experience.
All right.
Moving from the kids to the adults.
Great. So in your practice in New York, you really focus on body contouring, body work. How did you get into that? Because you're a board certified plastic surgeon. You could do it all.
So early on in my practice, I was like, I got to pick one thing. When someone asks you what you do, if you say you're a plastic surgeon, the next thing they say is like, but what do you do?
Yeah.
So like you have to hyper specialize in this world. And really is the messaging. It's not sticky unless you have a clear message. Like if I throw 4 tennis balls at you, like if I say I do face, breast, body, and non-surgical, you're not going to catch any of them. But if I throw 1 tennis ball at you, you're going to catch it and hold on to it tight. So when people are like, hey, what do you do? I'm like, I make moms look hot. They're like, got it. Like,
Nice.
I understand. So hyper focusing was really something I wanted to do really quickly. And the body was just made a lot of sense for me personally for a couple of reasons. Number one, there's really no non-surgical alternatives. Like it's been proven, like you can't get rid of loose skin with anything non-surgical. You can't put muscles that have been separated with anything non-surgical. And there's less competition. When you're neck up, it's dermatology, it's dentists, it's ophthalmology, it's facial plastics, plastic surgeons, and every med spa on, Main Street in America. So when it comes to body surgery, it's really just plastic surgeons. There's really no one else doing it. So that all made sense to me. And then, it's bubble gum, it's ice cream, like flat tummy, narrow waist, perky boobs, perky bum. Everybody's happy, like
Nice.
period, full stop.
Yeah.
Like there's like, you're batting 100% with flat tummies. Like no one's like, in the face and the nose, like you can do a perfect facelift, a perfect nose job. Someone may not like the way they look because they look different. Nobody doesn't like having a flat tummy.
Yeah.
Like just
It's pretty universal.
yeah, like if you give someone a flat tummy, they're like, thank you.
Yeah.
No one's like, kind of like that pooch and that all that hang.
Yeah.
Like it never happens. So
And especially for moms, they never expect. It's really hard. Childbirth is an experience. It's a beautiful experience.
and you get this permanent frustration
Yeah.
every time you look in the mirror, no matter how thin, how fit. Like I always say, you could never eat again. You can do a plank for a year. You're going to look exactly the same.
Yeah.
And this frustration never goes away. And it really interferes with their quality of life. Like when you can't wear clothes normally, you don't feel good. That sucks. And it's forever. So when we change that, I mean, the patients are always happy. and like it's a forever happiness.
That's awesome.
So it's just such a slam dunk. Like
And
every time, like we're batting 100. Like you just take, mom pooch, you get rid of it, and they're happy.
Yeah, a lot of moms ask me, they're like, do you think I should have surgery? It's just aesthetic and like,
No.
I'm feel guilty. But I said, no, it's not just aesthetics. It's functional too, like a diastasis or a separation in your rectus abdominis.
At 6 months or a year post-op when I see them, what they all say, it's not, listen, they all send me like their bikini shots and the tight dresses and the gym shots, and it's all fun. But what they really say is I don't think about my body anymore.
Nice.
And I can wear whatever I want, whenever I want.
That's great for
Versus, when I see them at consult, they're like, when I get dressed in the morning, there's a pile of clothes in my closet because I can't find anything that looks good on me. And I'm always thinking about my body. And a lot of like the professional women that I operate on, they say, at work, I think about work and not about how people are looking at me and thinking about my body. It is like a mental freedom. They just say, I wear whatever I want, whenever I want, and I don't think about my body. And that is a gift that gives forever. I think a lot of plastic surgery is just making people look different.
Yeah.
And this truly solves a problem.
Getting back to your older self.
Just getting back to a comfortable, confident self. Like a lot of my patients are not plastic surgery people. Like the people, they're, very successful in whatever endeavor. They don't want to look different, but they have a problem. They can't wear clothes normally.
Yeah.
And they've tried pelvic floor therapy, diet, GLP-1s, as much exercise as a human can do. And like nothing's really changing it. So they're like just stuck in life and they want to get comfort and confidence back.
So, surgery is definitely a definitive way to do that. Like you said, there's certain non-surgical things that won't, accomplish muscle separation. And in derm, we're always saying like, the neck is the new face because like now people are hyper-focused on their neck.
For sure.
In your world, the mommy makeover, is there a specific body part or is it really a comprehensive?
The traditional or legacy tuck, hip to hip in the front is, I think, gone in most part because a lot of my revisions I see are not from like Tijuana and Guatemala. Okay. My revisions are from Park Avenue and Beverly Hills. And what happens is they had a traditional legacy tuck performed well by a great surgeon. And they come to me.
Abdominal
they had a regular tummy tuck, a traditional old school one. And they come to me and they grab their sides and they grab their butt and they grab their back. And they're like, it looks like someone operated on like one side of the box.
Yeah.
So, I do much bigger operations. And the paradoxical or interesting thing is now we do much bigger operations to make people look more natural, more normal, more elegant. Meaning like you can't renovate, the upstairs bathroom and think the whole house is going to look different. Like I take apart basically the whole torso, like neck down to the pubic area all the way around.
Wow.
To put it all back together to look more normal, more natural, more elegant. It's a much bigger operation. Almost, 60, 70% of my patients are getting tucks that go all the way around or 3/4 of the way around because almost every woman I see is grabbing their sides after a tummy tuck done elsewhere. Someone may have done liposuction there, but like that's just going to make it thinner, but not tighter. And I can tell you the words women don't like. Loosey-goosey, okay? Like it's about tight, okay? Loose is not a word women who see me like.
Yeah.
They want to be tight, and they don't want to just be tight in the front, the side, and the back. So, for instance, this morning we did a circumferential tuck with a BBL. This is, a mom who has 3 kids and lost like 40 pounds, like 40, 50 pounds after each kid. She was pretty stretchy. And guess what? She wasn't just stretchy on the front.
Yeah.
She was stretchy on the side and the back. So we did the tuck all the way around, which means she's going to be tight all the way around. Who cares? The scar's hidden in the bikini. So like, who cares anyways? And we also did fat into the bum, not to make a bigger butt, to make a better butt. They like the
more
Pilates
lifted.
instructor butt, just a perky butt. The other thing we're doing now is the muscle repair has evolved dramatically. The old school or traditional way was just a line up and down the middle, thinking like your middle muscle separated. But when you're round, you're not just round in a straight, like you don't have a baby in a straight line. Mm-hmm. Like the lower abdomen has a curve left to right. So I always repair up, down, left, right, and the obliques.
Cool.
Because these patients want, it's great. The demands and the expectations are now through the roof, which is good for surgeons who like a challenge and constant evolution and push it. Like we create the operations in response to what patients want. They're like, I don't want to be loose. I want a perky butt and I want my tummy flat. got it.
Right.
Let's go back to the lab.
And yeah, and that's the importance of really finding a surgeon that you can relate to and also like who understands the assignment.
And
You know, yeah.
correct. And I think, by doing, almost 8,000 of these, where the average doc does maybe 30 a year and we do 500 a year, is, I have so many tools in my toolbox. I think every single operation, there's like 6 to 10 tricks. There's 6 or 10 things I see in everyone that's unique. But when you have like 8,000 under your belt, it's no longer unique. And you're like, I see this, like a muscle pops or is bulging in a certain area, or the skin's a little looser in a certain area. And I'm like, I know what to do in this spot because I've been here hundreds and hundreds of times.
Nice.
That's going to make the difference between a 7 out of 10 and a 10 out of 10. And I know that surgeons who just don't do this, like you can't conceptually guess your way through it. You have to, unfortunately, have made the mistakes to learn those little tricks. And every operation, if you speak to master surgeons, will tell you there's like probably every other move everyone can do, but there's like 6 to 10 little moves, tiny little things, certain type of stitch, certain type of lipo, a certain type of this, certain type of that just hits over the inflection point and gets you in the end zone for that, to win that operation.
Yeah. That's an amazing point, because I was just talking to a surgeon about, how they're teaching the next generation of surgeons and how we teach residents and fellows. And it's really the idea that the repetition and the at-bats, like you really have to.
You got to go deep.
You have to do
like
it. Yeah.
you have to go so deep, like you are in the abyss in the sense of like, when Dyson created,
eat, read, sleep.
When Dyson created, he did like 8,000, tests to figure out how to make, the Dyson vacuum. Like, that's how deep you got to go. Da Vinci always talks about going, why he did so many dissections of cadavers. Like he went so deep. And I think the master surgeons today, in whatever field they are, from, brain surgery to heart surgery to plastic surgery, are just going deeper than they ever have. They're just getting super narrow, and they're just going deeper and deeper and deeper, and like really being critical of themselves and critical of the results, and never stop evolving. Like they never for a second think they know it. There's like an old saying, as the island of knowledge grows, so does your shore of ignorance. Like the more you do, the more you feel like you don't know, because you're just so in it, and just like, what else can we do? How far can we go? How do we make it better, safer? How do we make the experience better?
I
keeps it exciting.
Yeah.
Like you just
I love this. Yeah.
Someone's like, oh, you've done the most of these in the world, yet you try the hardest to keep going. And you're like, yeah, I think that's the way it's supposed to be.
Yeah. And, for us in New York, and I'm sure different areas of the country, mommy makeover is part of the vernacular, right? Like people talk about it openly and freely. Do you think that now surgical plastic surgery, this idea is just more mainstream, it's more accepted, it's less taboo, like sort of like facial fillers and Botox?
Like I was saying, and someone asked a surgeon at a dinner party, what do you do? And they say plastic surgeon. Then the next question is, but what do you do? Like they want to really know. And I think patients used to say, it would be hush hush, and then they'd say they had a tummy tuck or something.
Yeah.
And then people would ask them about it. But now it's, I had a tummy tuck, and then it's, who did it?
Yeah.
There's a name. There's a brand. Like people want to know who did your facelift. Yeah. That's the first question. When someone says that, people are like associating their surgery with a brand, just like they associate their jewelry and their clothing with a brand.
Yeah.
And that's been a game changer, because I think when you actually have a brand people really want to be associated with, they want to share that.
For the younger viewers who are, budding plastic surgeons or aspiring doctors, is, for you, was the brand first, or was your mastering of the surgical experience first?
Brand is a lagging indicator of mastery.
Yeah.
Like,
I love that.
You have to get, surgeons come to me, what do I do? I said, pick something you like doing. You have to genuinely like it. Like, I just don't like face and nose. I don't do it. So I stick to the body. I'm a TNA guy, okay? So I stick to what I like. And then I'm like,
this is a safe space.
I'm like, get really good. And like, how do you get good? I'm like, do it for cheap. Do a lot of them for cheap. And then like, do a lot of revisions. Do a lot of take backs. See why it doesn't look, as good as you want. Get in there. Just keep operating. And once you get good, you can slowly charge more, because you're giving value, right?
Yeah.
And, price is what you pay and value is what you get. And when the value is higher than the price actually doesn't matter. As long as people think they're this is the greatest thing that's ever happened to me, they don't care about the price.
Yeah.
But you can't get there until you actually are good. Yeah. And if you're trying to build your brand before you've mastered something, you're just a con man.
Yeah.
Okay. Sure. You're just a con artist, right? If you're a great salesperson in surgery, but you can't back it up, you'll never really build a brand, because brands are entrenched into the
Yeah.
society, and like you just can't, because a happy patient tells 3 people, an unhappy tells 100.
You heard it here first. Yeah. And speaking of the post called you the creator of the Birkin Body. What does that mean for you?
Well, whenever you get the call that you're in the post, you're like freaking out a little bit. And luckily that day was a good day. But they came up with it because we had a long waiting list. It's expensive, and everyone on the Upper East Side wanted it.
Nice.
Which is pretty much, but I think what they really got into, what they were trying to say, that was kind of the zoomed out view. But if you double click on it, it was like, hey, there's surgery now that makes you feel like you are a Birkin bag. There's surgery that, like, when people look at you, they're going to be like, this person looks like well-crafted and they look amazing. And that's something that someone else really wants.
Yeah.
When they see a mom of 4 that looks so incredibly good, so beautiful, yet so natural and elegant, whatever that is, I want it, And I think that's where that Birkin came in. It was a feeling they get when they see someone who's had that operation.
I also thought when I read that it's also about the pre-surgical and the post-op experience as well for you, right? Because I mean, you're so meticulous on the surgery itself, but you've also created this whole pre and post-op experience, which I think is really unique and amazing.
Well, listen, when I got started, and every practice I saw, there was always great surgeons, but I thought the experience, and most of us know, we've all been to doctor's office, it's like the worst experience ever.
Yeah.
Like, I just saw that meme the other day where it's like, I feel like every receptionist at a doctor's office wants me to die or something. It's the experience in general in medicine sucks. And then I read, like, early in my career, I read a lot, like 2 or 3 books a week. And one of the books I've read, and is actually mandatory reading for all of our staff, is Danny Meyer's Setting the Table. And if you don't know, Danny Meyer's is like a famous restaurateur in New York. But, before Danny Meyer, people went in the United States to eat. And after him, it was like they went to dine. And he was like, why can't there be hospitality in restaurants? And I was like, why can't there be hospitality in surgery? Like, why can't we create this like beautiful experience where it's not just, the patient staying at the plaza and the plaza's all done up and you have the, the room with all the little details that make it feel warm. But it's like, why can't every member of our team every day want to make everyone feel loved, special, cared for? And each and every patient feels like that. I don't care if you're a prince, a princess, politician, celebrity, hedge fund, private equity, or housewife down the street. Everyone's going to feel like the most special in the world. And one of the things that we do that is unique is the doctor house calls. Like, when I see the patients in the morning after surgery and they like see my face and I'm there smiling and I tell them everything went great, no surprises, you look amazing. You can see like the feeling on their face, like they feel so relieved.
Nice.
Yeah, they have the nurse with them 24/7 that takes all the stress and anxiety. But when they get to see their doctor every day after a major operation, it's a game changer. And that's when they feel, we give them all the swag and the friendship bracelets.
Oh, nice.
And then they feel like they're part of this brand. And they always say to their friends, you have to go to my surgeon.
Nice.
They're not like, go to Dr. Hunt. They're like, go to my surgeon. And then they say my name. Like, they feel like they're part of the family. And, we send orchids on their birthday every year forever. Like, we maintain these relationships forever. And it's really, that's the hospitality part. We try to treat people the way we would want to be treated, and then more. And that's how you really, build a practice.
Yeah.
My patients are essentially all referred from other patients or doctors. Most of mine are like now almost all physician referrals. All the big facelift surgeons around the country, the big dermatologists, they send us to surgeons. And I work on those relationships too. When someone refers me, we send them flowers. And I call them and say, thank you so much for the referral. And I call them after the surgery, tell them how it's going. Like, relationships matter. It's pretty old school. Like, we don't have any AI, very little technology. We're like, just go see people and like sit with them and talk to them.
It's all part of the human interaction.
Because you can't replicate that with technology.
Yeah.
You just can't.
Not yet.
Being there, listen, there will nothing will be showing up at 5:30 in the morning and like being at the bedside of a patient and examining them and talking to them and going through their questions and their stresses and their struggles and being there. Nothing. Yeah. And you could probably count on your hand how many doctors in the country, plastic surgeons do that.
That's a super unique
2 hours extra of my day.
Yeah.
Every day. and we do it on the weekend.
That's
But that's the difference. I promise you, in whatever you do in life, if you want to go to another level, you're going to have to work a lot harder than everyone else.
for sure. Yeah.
And you're going
also
to
a
have to
good
do kind of stuff that you don't want to. Yeah, Saturday and Sunday morning. Do you want to go see? Maybe not. But you know what? That's the difference.
That is. And so how do you get your team around you? Because it's not just you. There's a whole team.
No, we hire for attitude and actions. Like
Yeah.
we hire winners. Like, exceptional people are allergic to mediocre people. And like if people want a job to check in and check out, they don't last with us. Everyone on our team is all in, whatever it takes, anything they can do above and beyond. And we recognize that every day with we always have this like internal team email, like shouting out someone who did something above and beyond every day. So everyone's always recognized, not just at bonus and compensation season, but like daily, they're recognized for those little actions. So everything goes noticed and they feel like, and they're really important. Like the front desk, I'm like, listen, when that woman gets off the elevator in 10 seconds, she's going to decide whether or not she likes us or not.
Yeah.
If you don't, stand up, smile and say, welcome, like it's over. Like,
It's very
so
Four Seasons.
everything, every touch point
Yeah.
is a touch point. Like, and if you breach any touch point, the whole thing falls apart.
Nice.
So we make that clear when we're hiring and recruiting. Like, this is a team where you're going to work really hard, but you're going to be part of something really special. You'll be compensated really well, but we're going to ask you to go above and beyond. Like the job description is the basics.
Yeah.
Everything is above and beyond that. And we need self-directed winners. Like I'm not going to be there. Like if I have to tell you how to, what to do in every little situation to make someone feel happy, like you can't work here.
Yeah.
We have a lot of like Orthodox people, and like our COO Mitch, who's here, is always running out to kosher restaurants to get the booby in the waiting room,
I love that.
Yeah. Like that's
Very New
above
York.
and beyond,
Very New York.
right?
Yeah.
Like how many people run out to get someone food that's kosher? Like we
That's
do
great.
that stuff all the time. And like no one's telling Mitch to do that. He knows. He's, sees someone sitting in the waiting room waiting for a while. You're probably hungry. You probably don't want like just the snacks we have. Listen, he knows all the cool spots.
Yeah.
Like we'll go get you something to eat. Like all these little things above and beyond.
Very Jewish and Italian. If someone's struggling, just feed them.
Yeah.
Things will
we
get
feed
better.
everyone. Yeah, exactly. The cure.
I love that.
Straight to the heart.
For your aesthetic, it's interesting. You're a surgeon. You have your own aesthetic, right? How do you translate the patient's wants and needs with your own? I think that's
You got to find your like tribe. Like I have this like long, lean, elegant, natural aesthetic. Like I don't do kind of weird. Like we don't make huge butts. We don't try to carve artificial abs. Like I'm like, hey, 6 months after this, I want people to look at you and just say she looks great. Not even that she had a great tummy tuck. Just she looks great.
yeah.
Not really know that you had anything done. And it's cultural. There are other places in the country. If you go to, Miami and California, like having that done look is very popular. We don't do that. Like I cook Italian food. If you want French food, you got to go to a different restaurant.
Yeah.
Okay. Like, we're just very clear on the way.
Very Upper East Side aesthetic. Like
Yeah. We want people to look long, lean, elegant, and natural.
Yeah.
That's the way we do it. Okay. And there's nothing wrong with doing it any other way. It's just not the way we do it.
I find New York in general, even, with the cosmetic dermatology, less is more approach is.
It's funny. It's less is more, but we have to do more to
yeah.
make it look less.
Yeah, to make it look effortless. Yeah.
To make it look like you didn't have
Yeah.
surgery, you have to do a lot of
Yeah.
surgery.
That's what I tell people about skincare.
Yeah. No.
You have to do some, maybe not you with the Aveeno vape, but you have to do a little bit more to make it look, just super.
Well, I think the trend of minimally invasive everything is kind of going to the wayside.
Yeah, it's interesting. Minimally invasive had this huge like peak, and now we're in this era of full, like you said, 360.
And look at the face; they do these massive, deep plane, taking out glands, resuspending muscles,
for sure.
and bones.
And so, how long does your complete mommy makeover take?
About 5.5 to 6 hours.
Okay.
And they're, I tell them you're basically on house arrest for a week.
Yeah,
It's going to take you a month to feel normal. And you're not going to see results. You're going to look worse for about 6 weeks.
So yeah, minimally invasive has, it shot up, right? And then now it's sort of more surgically driven. How do you feel about the minimally invasive, movement?
I think there's these concepts in business that, you can always charge more if you can deliver results faster, right? Like the dry cleaner that does same day is more expensive than the one that's 5-day. Anything you can do faster, people will pay more. So I think the idea with minimally invasive was really, hey, you can get surgical results without the downtime and the risks. And by the way, if that was true, like we would all do it.
Yeah.
But so there was a lot of push in the industry to make all these different devices and then huge marketing efforts. And then it took like a decade or maybe 20 years for people to realize they're not getting the results. And at the end of the day, if you can't deliver the results, it's just not worth it. But it was a fundamental business concept. If you can get results faster, you can charge a lot. So these non-invasive or minimally invasive were very expensive and they didn't deliver the results. So at the end of the day, people just want results. Like I do massive surgery with huge downtime. I do it 5 days a week.
Yeah.
Because the results are real and they last forever. Honestly, at the end of the day, people just want the results. And if there's only one way to get it and it means, feeling like crap for a month, they'll do it.
And society is becoming just more open with the idea of like talking about their work, talking about their body work. Scars are less taboo, nowadays.
It's funny, like everyone at consultation talks about scars.
Yeah.
Zero after. Zero.
They're just
Once
happy with the
flat
results.
tummy, they could care less.
They can hide it. Yeah.
And like scars are something like we refer a lot to derms and laser. And if they need a scar revision, we do a scar. It's like a little scar revision. But it is a non-issue.
Do you speak openly to your patients like this? Because I like how frank you are.
I always tell them I'm going to be brutally honest with you because I can't remember lies. I'm too busy. So I'm just going to be brutally honest with you. I tell them all, like, this recovery is going to suck. I'm like, you're going to hate me for like a month and then you're going to love me the rest of your life.
Yeah.
And I'm like, it's going to suck. And I think the biggest problem with what I do, they feel better before they look better. So for like a couple weeks, they feel like crap. Okay. And they look like crap. So it's like in line. And then they feel fine, yet they still are like swollen and bruised and stiff and tight. And like, that's the annoying phase. I call it like swell hell. And then it really takes like another like month. It's like 6 weeks until they really start thinking, and this like post-plastic surgery, like emotional disturbance is like a real thing. Like there's a lot of people like, I always get the, what the hell did I do? Yeah. And then there is 100% an inflection point, usually around 6 weeks, where like, this is the greatest thing I've ever done.
For sure.
But like, I tell people, because I spend a lot of time talking to my patients, like recovery is like up. The curve goes up. You're always improving. But if you zoom in on that curve, it's like this. Like some days you're just so swollen and stiff and miserable.
It's an emotional roller coaster.
It's an emotional roller coaster. And it takes a while to get over it. And I explain to them, like, your body went through trauma. It doesn't know that it had like elective cosmetic surgery or it's getting waterboarding. Okay? It's like the same chemicals going through your system. Yeah. And your brain's trying to navigate all this. Yeah. So it's very natural to have like negative downward emotional days.
Yeah. And we see that even in the, our skin cancer surgeries, like on the face, in the beginning, everyone's just worried about the skin cancer. They want it out. Yeah. And then after it's out and it's clear, they're, now hyper-focused on the scar or the flap or the graft. And they go through this emotional roller coaster. But I always tell them, we're here for you.
You have to be there.
We're not going to abandon you. Yeah.
Like they have to be able to reach out to someone.
Yeah.
And whether it's you need a big team. That's why it's like, I'm in the OR like 10 hours a day. Yeah. So each of my patients get a text chain with 2 nurse practitioners that they can access 24/7. And like at the end, like when I come out of surgery, they have like a list, like you got to call this lady. Yeah. Like, she needs to hear from you. Yeah. Like we've tried to but she needs to hear from you. But at least there's always someone.
The reassurance.
To be there, like, so they don't like go off the edge, and that makes a big difference. Just being able to call and someone says, this is normal. And they're like, and we're here for you. Makes the difference.
It is a very intimate relationship. You're working. It's a privilege to, operate on these human beings.
It's a huge honor and a privilege. Yeah. And I say every day is our Super Bowl. Yeah. Every case is Super Bowl, right? Nice. There's no small surgery. Every case is the most important case in the world, and every patient's the most important patient in the world. And I've said this, whenever we have new staff, I'm like, I know you think it's Tuesday, but this is the biggest day in this person and her family's life. So like, get your game face on.
Yeah. I'm gonna play this podcast for all of my
listen. You
employees.
Can take them in the operating room and cut them in half.
I know.
Like you better. It's game time. Yeah. Like everyone, like you'll see if you follow our Instagram. Like you see all my staff. They follow me. They're in the gym at like 4:30 in the morning. They're getting ready to go.
I'm at Equinox at 5. Again, not a plug, but working out with my trainers who have been on this podcast. How do you stay fit, focused?
Well, like
healthy.
Seneca said, I'm a big reader of Stoic philosophy. Said,
Yeah.
like you have to be rigorous with the body so it will be obedient to the mind.
Nice.
Meaning,
I have that book on my bedside too. Yeah.
it's really important. Like the physical fitness for a surgeon is huge. And it really is. Be rigorous with the body so it will be obedient to the mind. Because when it's 3, 4 o'clock and you've been in the operating room, 7, 8 hours, like you have to be physically and mentally strong. You can't like have a moment when someone's bleeding that you're physically or emotionally tired. Like you have to be in like, and you got to be disciplined and give things up. Like you have to be like, I'm going to go to bed early. I'm not, I don't drink, go to bed early and like get up and exercise, eat, take care, be rigorous. Like I think it is upon us like to be above and beyond disciplined.
Yeah.
Because
your patient is expecting. Yeah. They expect.
Patients like to see their surgeon like physically and mentally fit. Yeah. Like they like to know that like every day I'm exercising and like I'm really dialed in on myself so I can be there for them.
Yeah.
And I think, I don't think I've ever seen like a really unfit surgeon like that was really good.
Or
like,
or cardiologist that smokes. Yeah.
Well, I just think like, listen, if you're not disciplined out of the OR, why would someone think you're going to be disciplined in the OR? Yeah. Like all of a sudden you become a different person. Like you are who you are.
Yeah.
Like the way you do anything is the way you do everything.
Yeah.
And I mean, all the surgeons that, I admire, like they have their acts together.
For sure.
From top to bottom, left to right.
I would hope so.
Yeah. Like, and it's a different life. Like you sacrifice things, but like, if you want to be a great surgeon, be willing to sacrifice things that other people do. Yeah. But it doesn't feel like a sacrifice because the joy you're getting is the impact you make in the OR.
Yeah, there was a recent JAMA article that monitored, surgeons, general surgeons, their heart rate while they were operating.
Oh yeah,
and it was kind of interesting and cool because they saw that the surgeons that got stressed but who were able to navigate the stress well had better outcomes, and so that little bout of stress or that heart rate jump actually helped them like lock in and focus. So stress can be a natural response to help you just like really focus in, but you have to
but if you're doing intense exercise, you get used to the feeling of having a high heart rate.
Exactly. Yeah. And you don't freak out by like the basically physical response.
Correct.
Which is cool.
Everyone feeds off you. When there's something happening in the OR that's stressful, everyone will do what the surgeon does.
Yes, yeah. It's very much you're the center. We know the mommy makeover, but what about the daddy do-over? Are you seeing that or?
It's funny. At about 6 months after mommy makeover, usually the husband texts me and he's like, "Hey, she looks so good. What do you got for me?"
Do you call it a daddy do-over or what?
No.
I just thought that I came up with that.
It's interesting. I think the real thing why male surgery isn't as popular as female, and it's not that men don't want it. Women tell everyone, men tell nobody.
I know, guys, like we got to spread the word. Yeah.
And like, you just don't get word of mouth. Like I've operated, I'd only say about 1 out of 50 of my patients are male, and they never tell anyone.
I know.
It's like it never happened. Yeah. It's really hard to build a male practice without any word of mouth.
Yeah.
All of the women I know all the other, all the women I operate on are their whole friend circle. I've operated on them.
It's a
men
good question.
Would never tell anyone.
Are they gatekeeping or are they just like embarrassed? Or?
I don't think that it's just sometimes things are just what they are.
Yeah.
Okay. And there doesn't have to be this like huge explanation. I do a lot male surgery and they don't tell anybody. So it's really hard to grow a practice. Yeah. If you said gun to my head, I had to have a male-driven practice, I'd figure it out.
Sure.
That's where we are.
It's like men's skincare. It's always there, but it's never as much as like, female marketed skincare.
I don't know if the social value of looking good is just not as important to men. Because I see a lot of men now that get referred from the endocrinologists and the longevity docs who've lost like 75, 100 pounds on GLP-1s. And they have like a huge flap of skin. Sure. And I'm like, dude, you need a tummy tuck. Okay.
Yeah,
you can't even see your pecker. Okay. Yeah. And they're like, nah, I'm good. I'm like, okay. Like, whatever.
Yeah.
And like,
maybe high.
They just like, it's not as important to them.
That's so interesting. We could take a deep dive into that.
And I never obviously convince anyone to have surgery, but they're always like, what's the least invasive? I'm like, your skin's hanging to your knees. There's nothing little. Yeah. Okay. You need a big operation.
You need invasive.
And I can show them pictures and scars and they just don't want to do it.
And, just I guess, conclude, one thing that people always say, that you'll look fake if you get surgery. How do you respond to that?
I think the true mastery, like the best surgeons, make people look as natural as
Yeah.
possible. And again, it's paradoxical or sometimes difficult for people to understand that you need major surgery to look less done. Like you have to take everything apart and put it back together to look like you never had surgery. When you start operating on different body parts or trying to do less, that looks done.
Yeah.
Because like it looks like something, like looks odd because things were left behind.
And, a lot of my patients, I made my skincare line in Korea. I've been to Korea multiple times. They do a lot of amazing things.
Mhm.
But now a lot of, US Americans are traveling to Korea for either face work or body work.
I
And
hear
it's-
about this from my wife all the time.
Yeah.
Let's go get skincare in Korea. I'm like, you're in New York City.
Yeah,
like,
I know.
why are you going to Korea?
Yeah,
Like, what are we
exactly.
talking about here? She's like, I don't know. Everyone says they got cool stuff. Over
Yeah.
there. I'm like, what do you think they have that we don't have?
No, exactly. And that's what I tell my patients. Everything they have, for the most part, we have here, or some version of it.
But
And
there's
this-
a brand now.
Yeah, there's a brand.
I see all these women going on like women trips to South Korea for
Yeah.
skincare trips. I'm like, okay. Like,
What's
this is a
alarming,
thing.
though, is that they're going other places for surgical intervention. And, that scares me a little bit, because I'm worried that, it's really the post-op as well that you need follow-up. And if you don't have that.
Well, I get a lot of patients. I get a lot of patients in South America, Europe,
Yeah.
Paris and London. We have a huge amount. And then in the Middle East. And it's funny. I get a lot of patients from Colombia, from Brazil, who want that New York aesthetic. And then Miami, LA, Dallas, Nashville, Houston, and Atlanta. Shout out to my Buckhead community. I mean, we get a lot. I think there's a lot of travel now the other way.
That's good. That's great.
I don't
Yeah.
really see those patients who go off and
Yeah.
have problems elsewhere. Speaking of that, interestingly, because I know a lot of surgeons around the world, when you go to these places, Tijuana or wherever, I actually think the surgeons are really good.
Sure. Yeah.
And I think the reason they get into problems, it's not the surgeon, it's like the facilities. Like I can tell you, owning and running a surgical facility in Manhattan is so expensive.
Yeah.
Okay. If you want to be like top of the line, sterile, all the top medications, the top anesthesiologists, the top consultants, like, a sterilizer for your equipment is like, say 50 grand. You need like 3 of them and they break all the time and you don't you don't fix it. You just get a new one.
Yeah.
Okay. I mean, could be $500,000 a year just to sterilize the equipment. All right. That's one out of like 200 things you have in the operating room. And I think when you go to these places, it's all that kind of stuff. And like one breach in sterility anywhere can lead to a life-threatening or infection.
For sure.
And then the aftercare, the 24/7 nursing and the access to doctors. I think, early symptoms like, I have 24/7 nursing because I want to catch a problem when it's smoking, not when it's flaming.
Yeah.
And we can, problem solve quicker. And I think I know there's amazing surgeons everywhere in the world. It's the facilities, the aftercare, it's everything around it.
Nice. So, just to conclude, this show is called Give Good Face. So we always ask our, guests, what does it mean for you to give good face, or in your case, good body?
I can tell you, success for me is a lagging indicator of the amount of impact I've made on people's lives. And when I think of that, I think threefold: my family, my staff, and my patients. Am I being a good husband and father? Am I being a good doctor? And am I being a good boss?
Nice.
That's success. And it's the delta change or the amount of impact I'm making on all 3 of those. That's how I measure success.
That's amazing. And that's a great note to end on. Thank you.
You're welcome.
It was a pleasure to have you. And I feel even more inspired. So I hope everyone does too.
Thank you very much.
Subscribe wherever you get your podcasts and join us as we explore beauty, confidence, and the art of showing up like only Give Good Face can.